Hello friends, today we're going to discuss about health insurance for psychotherapy. I'm Dr. Suresh Bharadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the challenges faced by persons with mental illness when getting reimbursement from health insurance companies. And this becomes more pronounced when psychotherapy or counseling is added to the package. This video makes an attempt to raise awareness regarding this burning issue and possible remedial measures are suggested. Here, we need to discuss this issue. Hence, I am bringing this issue so that the persons with mental illness right to access mental health care is upheld. This is Section 18 of the Mental Health Care Act of 2017. All persons with mental illness should have access to psychotherapy. Hence, the insurance becomes very essential. In this regard, Kiran and his colleagues has published an article in Indian Journal of Psychiatry in May 2024. I am one of the authors of this article. The whole presentation revolves around this publication. To download this publication, please scan the QR code. You will be able to get the publication. Here, we are not going to make any statement or I'm not making any recommendation. I'm raising certain important pertinent issue with regard to rights of the persons with mental illness. For several reasons, insurance companies are not able to adhere the law, which is being told under Mental Health Care Act of 2017. The reason being is mental health has been excluded in various private insurance and also in a public insurance. That can be because of attitudinal barriers or else maybe exclusion clause which have been kept there. Considerable proportion of mental health services are placed in the exclusion clause. Hence, the daycare treatment, rehabilitation services, halfway home services, pre-existing mental illness, outpatient department treatment are excluded. That means not all, most of the insurance companies do not provide health insurance for persons with mental illness. At the same time, if you look at from the perspective of insurance company, they face obstacles in developing this policy because there is lack of clarity with regard to treatment modalities, who should be treating the person, who is mental health professional, and who should be providing counseling, who should be providing psychotherapy, how the reimbursement of medication, brain stimulation, ECT, psychotherapy, what should be the number of session? It should be only inpatient or outpatient? Should it be every week 3 or 4 sessions? Hence, they find it very difficult. Along with this, neurodevelopmental disorder such as SLD, autism spectrum disorders, mental retardation or intellectual disability, should they be included or not? And they are lifelong. That means this adds burden to the insurance company. Hence, we need to look into both the aspects. Thus, in this video, I'm trying to provide an outline of the challenges, what may be the best remedial measures, and there is a need for discussion from various stakeholders so that the persons with mental illness rights are upheld as per Mental Health Care Act of 2017. Let's define counseling. As per American Counseling Association, counseling means a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. So, this is very clear. But with regard to psychotherapy, psychotherapy is a type of treatment that can help individual experiencing a wide array of mental health conditions and emotional challenges. Psychotherapy can help not only alleviate symptoms, but also certain types of psychotherapy can help identify the psychological root cause of one's condition so a person can function better and have an enhanced emotional well-being and healing. This is the definition given by American Psychiatric Association. Unfortunately, there is not a single accepted definition of psychotherapy or counseling across the world. Many people have defined counseling and psychotherapy in different ways. Many a time, both counseling and psychotherapy are interchangeably used. Many of the psychiatrists will say, I'm doing psychotherapy, but they end up doing only counseling. And many a time, people say, I'm doing counseling, they end up doing psychotherapy. Counseling is shallow and it is specific to certain situation in life. Psychotherapy is considered deep with regard to emotions, cognitions, and behavior. It has a long-lasting effect. That's how the differentiation between psychotherapy and counseling is considered. However, for this video, both are considered same because many times psychiatrists do spend time with the patient, either counseling or doing psychotherapy. Hence, we need to uphold the rights of a person with mental illness, either he receives counseling or psychotherapy. However, if you consider the simple definition of National Institute of Mental Health, they define psychotherapy as a variety of treatment that aims to help a person identify and change the troubling emotions, thoughts, and behaviors. So this can be considered as an acceptable definition, which is broad, which encompasses both counseling and psychotherapy, and it is termed also as a talk therapy. So this can be one of the definition for the purpose of health insurance. Now let's look into the legality. Mental Health Care Act of 2017, Section 21(4) clearly says that every insurance company shall make provision for medical insurance for treatment of mental illness on the basis which is available for treatment of physical illness. That means there should not be any discrimination for persons with mental illness. They need to provide insurance. That means if there is a medical insurance for medical illness, it should be par with physical illness. Here, for the chronic illnesses in medical condition, it may be diabetes, it may be hypertension. Similarly, the chronic conditions like schizophrenia, bipolar disorder, autism spectrum disorder need to be dealt similar to diabetes or hypertension. That is how this law has been envisaged. In this regard, Insurance Regulatory Development Authority of India brought in a circular that was on 18th October 2022, which mandates every insurance company to develop and offer insurance for mental health services. To download this circular, please scan this QR code. Now let's look into the various challenges faced by insurance company and also by the persons with mental illness. Many insurance companies, with regard to medical insurance, they exclude alcohol and substance use. With regard to drugs, maybe cannabis, morphine, they say they are illegal drugs. Hence, insurance cannot be offered to them. Further, neurodevelopmental disorders such as autism, SLD, they say they are by birth, hence we cannot cover them. Many of them, insurance company exclude suicidal attempt and treatment subsequent to that. Many of the insurance company will not cover pre-existing mental illness. I have been contacted by persons with mental illness and their family because rehabilitation services, halfway home, rehab, the health insurance companies reject them because they say it is rehabilitation. They refuse to give daycare center related reimbursement. SLD remedial measures have been refused. And many a time, these insurance company, even if they offer, they place sublimits for the claim. They say only 5 to 25% of the total sum assured will be reimbursable. For example, if I have taken insurance for 5 lakh rupees, if I develop any kind of mental health related issues, the reimbursement will be maximum is 25%. That is, I'll be able to get a reimbursement of 1,25,000 rupees. Above that, the insurance company will refuse to pay. Many a time, they place co-payment. That means 20/80 or maybe 60/40. That means 60% will be paid by the insurance company, 40% has to be paid by the patient. Many a time, they also place a waiting period for pre-existing mental illness, or mental illness will be covered only after 3 to 4 years of subscribing for the insurance. Many a time, insurance company refuse to cover pre and post hospitalization support. Domiciliary treatment is also not covered. That is, if the patient wants to take treatment at home, they say we will not be able to give treatment at home related reimbursement. Further, psychotherapy. Which psychotherapy should be reimbursed? Whether individual psychotherapy, family therapy, or group therapy. That means, imagine if a patient has taken individual health insurance, and if he has to go for a therapy, and it involves education of the family members, those sessions should be covered or not? How many sessions can be covered? How frequently can be covered? How long? Imagine if a therapist or a psychiatrist does 3 sessions in a day. Should it be reimbursed all 3? Or else every day if he does therapy, should it be reimbursed? Who should be doing it? Is it only psychiatrist or anybody? Should it be done outpatient, inpatient? If psychotherapy and ECT is given together? If ketamine and psychotherapy is given? Other brain stimulation and psychotherapy is given, should it be reimbursed? So these are the challenges both the patient parties and also insurance companies face. Hence, we need to have a proper definitions. Again, the definitions, as you mentioned, many of the insurance companies have raised objection with regard to reimbursement for mental illness. The definition of mental illness as per Mental Care Act of 2017, Section 2(s) says a substantial disorder of thinking, mood, perception, orientation, or memory. Substantial disorder means only severely mentally ill patient will be reimbursement can be given. Further, mental conditions associated with alcohol and mental retardation are excluded. That means only schizophrenia, severe OCD, bipolar disorder are reimbursable. That too, when they lose capacity. That means substantial disorder of thinking and mood. So this has been the objection by some of the insurance company. But however, patients' party say it should be considered as Section 3(1). That is, mental illness shall be determined in accordance with the nationality or internationally accepted standards, that is ICD or DSM-4. Now, again, the question is, should the insurance companies claim Section 2(s) should be considered or Section 3 as per the persons with mental illness? This needs to be addressed. However, in the larger interest of persons with mental illness, rights to be upheld, Section 3 is the appropriate one. Hence, my dear friends, if the insurance company refuses to reimburse or pay till citing section 2S, please ask them to read the preamble of the Mental Health Care Act of 2017 and challenge their decision in ombudsman. But however, Mental Health Care Act excludes mental retardation and substance use disorder. Hence, they may have a valid reason to reject them. Hence, this issue needs to be settled in the court of law with regard to intellectual disability and substance use disorder. Now the question comes, who can practice psychotherapy and the reimbursement should be given or not? That means if a person who is not registered, who is unqualified, who is untrained, if he does psychotherapy, should it be reimbursed is a question. In this regard, we need to go into depth from the legal angle. Simply, National Medical Commission Act 2019, under their curriculum of psychiatry, invariably the psychiatrists are registered, their course are monitored, hence the psychiatrist will come into picture. Nursing Council Act 1947, invariably the psychotherapy or counseling done by the nursing who are trained in psychotherapy or specific psychotherapy becomes eligible, and invariably psychiatric nurse, their curriculum with regard to CBT and other therapies are trained, hence they also become eligible. Invariably, most of the time spent with the patient is psychiatric nurses, and also many nurses who have undergone training in various aspects of psychotherapy. Mental Health Care Act of 2017 labels various mental health professionals. They become eligible, including Ayush, because Mental Health Care Act of 2017 respects alternative treatment from other modality. It can be Ayurveda, it can be Unani, it can be Siddha or homeopathy. Further, the person qualified from AIMS, PGI, JIPMER and NIMANS, if this degrees or certificate given by them telling that this person has undergone training for a specific therapy, they become eligible for reimbursement. And the recent National Commission for Allied and Healthcare Profession Act 2021 tries to regulate various allied and healthcare professionals. Under this, if you are registered under behavioral health counselor and if you are doing therapy under the law, you will be able to get the reimbursement from the insurance. Rehabilitation Council Act of 1992, Section 13, subsection 2 also talks about various people. Let's look into the RCI, Section 3, subsection 2. Any person being a doctor or a paramedic in the field of physical medicine, rehabilitation, orthopedics, ENT, ophthalmology or psychiatry, they have been allowed to practice rehabilitation profession. So this becomes very vast, but just because you are registered and this law gives permission doesn't mean you need to practice psychotherapy. You need to undergo training in specific psychotherapy and you need to be accredited from your profession. If you look at the National Commission for Allied Health and Healthcare Profession Act 2021 and you are eligible under this legislation, please do register under the enrollment portal. Please scan the QR code and enroll yourself. This legislation also gives power to practice therapy. Now let's look at the public sector insurance, specifically Ayushman Bharat. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. In this country, 40% of the population are covered under this, and 5 lakh rupees cover is given. And this central package covers mental illness and it covers even for psychotherapy, diagnosis, assessment, counseling, and rehabilitation in public mental health establishment. That means it is only in public mental health establishment. That means if you are in private, it does not cover. This is one of the drawbacks of this PMJ insurance. However, the discussion, what I come to know is they want to test what is the cost involved in mental health treatment in public sector, so that that can be extended to the private sector in coming few years down the line. That means they are doing a pilot to know the cost of treatment of mental health in public sector. Further, Niramaya health insurance schemes covers developmental disabilities. So that also be considered under the government health insurance. Let's look into the private insurance. Now, the issue starts cropping up. The insurance company wants to protect their interest. Hence, the author of this paper suggests that the diagnosis has to be done as per ICD or DSM-4 or DSM-5. Diagnosis to be done by a psychiatrist. A referral letter from the psychiatrist should be there for psychotherapy. And psychotherapy should be done by the registered practitioner, as I mentioned in the law. Further, which type of individual psychotherapy? It can be individual therapy such as psychoanalysis, behavioral intervention, applied behavioral intervention, CBT, DBT. Since Ayush is also considered under Mental Health Care Act, yoga, interpersonal psychotherapy, supportive psychotherapy, gestalt psychotherapy, crisis management, and various other therapy which has been mentioned here. Further, structural and systemic family therapy, solution-focused friend therapy, and family psychoeducation. All these need to be covered. This is the author's suggestion. However, the discussion between the insurance companies, persons with mental illness, and the service providers, engagement should be done, and the white paper should come. Reimbursement of psychotherapy. Let's discuss about what are the components of psychotherapy and how the reimbursement can be done for outpatient services. Invariably, per day, the session should be 45 to 60 minutes is reimbursable. If a person does 3 hours psychotherapy, then the maximum reimbursement is for 60 minutes. Frequency will be 1 to 4 sessions per month because it is outpatient based. Sessions can be 10 to 20 sessions based upon the discussion between the patient and the insurance company. Invariably, adequate psychotherapy is between 16 to 24 sessions. The type of therapy, here we should consider eclectic psychotherapy. That means any kind of therapy should be reimbursable, because every therapy should be tailored based upon the diagnosis and the patient's choice. Payment, as I mentioned, between 10 to 20 session, cost may be 500 to 1000 rupees. This is again, it is between the insurance company, service provider, and persons with mental illness. It is just a suggestion. I know there are many people who can charge 5000 rupees per session, but for the purpose of insurance, the insurance company also has to have a reasonable charges. Similarly, mode of therapy, both in person and virtual should be considered. Number of course of therapy as per the insurance policies, maybe number of sessions can be capped, or else 1 or 2 courses can be considered per year. Similarly, for inpatient services, sessions per day should not be more than 45 to 60 minutes. Frequency as and when required, because the patient is admitted. In an inpatient, since he is severely ill, he may require session maybe morning and evening, or maybe per day. For example, the patient may take a session 30 minutes in the morning and 30 minutes in the afternoon. It is left to the psychotherapist or the psychiatrist who is providing services. Sessions can be 15 to 20 sessions, or maybe based upon the discussion. And sessions per day will be 45 to 60 minutes. Type of therapy, I would rather focus on eclectic psychotherapy. It is based upon the therapist and the client. Payment should be for a package. That means package is for an inpatient. 16 to 24 sessions can be considered as an adequate therapy, although many patients may require 50 or 60 sessions. But the therapy will be given for 16 to 20 sessions will be the reimbursement. If the patient does only 2 sessions, the insurance company will get the full package cost. Similar to radiation oncology, where the patient undergoes radiotherapy, there the package is the reimbursable. The patient may require 30 or 40 sessions, the therapist will give, because the package has to be complete. Further, the cost will be based upon the agreement between the therapist, insurance company, and the client. Mode of therapy, since it is an admitted patient, in-person therapy is the best because the patient is severely ill. Hence, the in-person would be recommended. Number of course of therapy sessions is based upon both. Now let's discuss about the gray area, where there should be discussion between various stakeholders. For example, if you are giving supportive therapy for the family members, caregiver burden, since the person is not has the health insurance for the caregiver, should it be given or not? This is the discussion has to be done. Neurodevelopmental disorder, whether should be given or not, that discussion has to be brought in. Prodromal cases, high risk cases, or else relapse prevention therapy, if you are doing, should it be given? Because he is not suffering now. It is a relapse prevention. Suicide, secondary to financial or any other cause, should it be the reimbursement be given? Suppose interpersonal distress, marital discord within the family. So these should be included or not. That needs to be discussed. And again, the issue of substance use is a bigger issue which need to be addressed at the earliest. Now, some few suggestions which have been given in the article are: all insurance companies need to comply with the treatment of mental illness, and those insurance needs to be reimbursed. Mental illness needs to be defined as per Section 3 of the Mental Health Care Act. Mental health care includes treatment, rehabilitation, it can be halfway home, daycare center, and other services should be considered. Psychotherapy can be tailored according to the need of the patients, and psychoanalytic psychotherapy is the best, but however, it is based upon the therapist and the client's agreement. Psychotherapy is provided by the mental health professionals as per the Mental Health Care Act of 2017, Ayush doctors, RCI, and National Commissions for Allied and Healthcare Professional Act should be considered. Insurance for both family therapy, individual therapy, group therapy should be reimbursable. Both inpatient and outpatient psychotherapy should be considered. So these are the various important points need to be allowed. Further, the number of psychotherapy reimbursement should be between 16 to 24 sessions. It can be per year or per 6 months should be considered. Both inpatient, outpatient, in-person, virtual should be considered. The cost should be discussed between the insurance company and the therapist. Therapists need to provide basic medical record only, not the complete whole record if the insurance company demands. It will be the patient's responsibility to claim insurance by providing the records rather than putting the blame on the psychotherapist or the psychiatrist. Hence, the record should be handed over to the patient, and the patient will submit according to his wish and will to the insurance company. Insurance coverage for persons with mental illness is a mandatory under Mental Health Care Act of 2017. So, my dear friends, please remember that it is a statute where mental health is under the health insurance. That needs to be an important obligation for all insurance company. There is an urgent need to develop the guidelines involving all the stakeholders. A consensus statements need to be evolved from all stakeholders so that any kind of dispute can be settled. Further, psychotherapy services need to be brought under the insurance so that the persons with mental illness can get access to mental health care services. Ayush has been recognized under the Mental Health Care Act of 2017. Those services also should be covered under the insurance. There is a need to pilot project for certain diseases so that the cost of each disorder can be brought in so that the insurance company can place the premium appropriately as per the market. Unfortunately, in the absence of informed evidence-based decision, insurance companies are shying away from their responsibility of providing insurance to persons with mental illness. Thank you very much for giving your valuable time. Stay safe.